Welcome to the Sexuality, Intimacy, and Ovarian Cancer Conference Call. And we'll now turn the conference over to Ms. Fran Turner, National Program Director. Please go ahead, ma'am.
Thank you. Ovarian Cancer Canada welcomes you today to the first session of the new year in our telephone education series for women with ovarian cancer and their caregivers. Today's program, as was mentioned, is entitled Sexuality, Intimacy, and Ovarian Cancer. I know that Dr. Ann Katz, today's speaker, will provide you with helpful information about an important aspect of women's health and well-being as she journeys through diagnosis, treatment, and beyond. I'm Fran Turner, National Program Director of Ovarian Cancer Canada. Ovarian Cancer Canada endeavors to provide women with ovarian cancer and their caregivers the information they need. 3 previously recorded telephone education sessions, one on peripheral neuropathy, another on bowel side effects of treatment, and the last one on advocacy and finances, are available on YouTube at our site www.youtube.com/Ovarian Cancer Canada. The videos have been posted in 10-minute segments and ordered in parts to make it easy for you to listen and later return to where you left off. Please subscribe for updates, and we will be posting you to YouTube on an ongoing basis. A health professional has let us know that YouTube is a restricted site at her institution and that staff at the center cannot access the replay. I want you to know that we're using YouTube because it is a less expensive way for Ovarian Cancer Canada to bring these videos to you rather than using our own site. I also want to let you know about our upcoming session in February. On February the 7th, we're having a session on complementary and alternative therapies in ovarian cancer. It features Tracy Truant, a nurse researcher with the BC Cancer Agency who investigates the use of complementary and alternative therapies by cancer patients, and Dr. Cheryl Proctor, a Toronto naturopath who specializes in women's health. Coming up in March, we'll have a session on fatigue and chemobrain. Today, we're delighted there are survivors, family members, and healthcare professionals from across the country in the audience. We hope that you can help us with your feedback. An evaluation form will be sent to attendees today by email or regular mail, and we would appreciate your thoughts about today's session. So, I am delighted to introduce our speaker, who is Dr. Ann Katz, a registered nurse and PhD. Dr. Katz is a sexuality counselor at Cancer Care Manitoba in Winnipeg, Manitoba. For 5 years, she has provided counseling to men and women with cancer who are experiencing difficulties as a consequence of cancer and its treatments. She's also adjunct professor at the University of Manitoba. Dr. Katz recently completed a textbook entitled Breaking the Silence on Cancer and Sexuality, a handbook for healthcare providers, published by the Oncology Nursing Society in 2007. And so I'm very pleased to let you have the podium, Dr. Katz.
Thanks, Fran. Hello, everybody, and welcome to this call. I have actually not done something like this, and it's certainly, for me, as probably as well as for you, just a little bit challenging to be. I'm sitting in my office, and there are piles of paper everywhere, and my computer screen in front of me, and I really am missing the that immediate gratification of looking into people's faces and seeing their response. So I have a mental picture of people on the phone. I know what Fran looks like, so that's about all I know. So I have perhaps a little bit of an advantage of some of you far and wide who may not have that. So let's get started. Ovarian cancer, as many of you know, can have a profound effect on a woman's sexuality and on her relationship with her partner. And this is why I've titled the session Sexuality and Intimacy, because I really don't use the term intimacy as a euphemism for sexuality. And sexuality, from my perspective, is something very broad. Sexuality is something that we have from a very, very early age. Many of you who have parented know that one of the first things that a little baby does when you take that diaper off is that little hand goes down to their genitals, boy or girl, because it feels good. So sexuality really does start at a very early stage, and sexuality is something that is with us, whether we are partnered or not partnered, whether we are sexually active or not. It really is broad. It encompasses our hearts and our minds and our bodies and our souls. It's about how we think about ourselves as men or women. And so it is really a broad concept from my perspective. Intimacy, in my way of thinking, is that connection that we have with someone else. In the context of a loving relationship, sexuality or sexual activity, perhaps better, is the expression or sometimes the way that we get to that intimacy or that heart-to-heart connectedness with people. But on the other hand, one can have a very, very intimate relationship with someone that does not comprise any kind of sexuality at all. So I really, want you to sort of really broaden the way you think about sexuality and intimacy, certainly through this call, and I hope in the days, months, and years ahead of you. So ovarian cancer really does affect sexuality, it affects sexual functioning, it affects sexual activity, and those may all affect that intimate relationship that we have with someone, or even that intimate relationship that we have with the essence of ourselves, because it alters the cancer, and the treatment can alter the way we think of ourselves. So as many of you know, ovarian cancer is often diagnosed quite late in the disease process and requires aggressive multimodal treatment. There is actually surprisingly little in the research literature about the sexual effects of this cancer in particular and its treatments. Any studies that have been done have sort of tended to lump women with gynecological cancer together. So there'll be some endometrial or uterine cancer lumped in with cervical cancer, lumped in with ovarian cancer. So, as a professional, and particularly in doing the research to write my book, it was actually quite difficult to find anything about the experience specifically of women with ovarian cancer in terms of sexual side effects or sexual consequences. However, we do know from our understanding of the human body that surgical removal of the ovaries, which is usually the first stage of the treatment, profoundly affects the hormonal status of the woman, particularly premenopausal women. And as a result of removal of the ovaries, you have immediate menopause. Sometimes we call this surgical menopause. And women suffer greatly from exaggerated symptoms of the menopause, hot flashes, irritability, vaginal dryness, even leading to vaginal atrophy, which is a harsh word, and but it's a word that is frequently used in the medical and nursing literature. Certainly vaginal dryness is associated with an increased incidence of urinary tract infections, and I think overlying everything here is profound fatigue, which I hear over and over and over from women that the fatigue is sometimes the worst of it. Removal of the ovaries and uterus also ends the woman's reproductive potential. Now, for some women, this is perhaps not a big issue. They may have completed their family or are childless by choice. But for some women, they never really want to shut that door. And often the surgery occurs in a hurry, and women may not be adequately prepared emotionally for the finality of this. Now, of course, life and limb is important as well, and when faced with a life-threatening diagnosis, most women would say, do whatever you can. I want to live, I want to survive. So decisions are made in an altered reality, essentially. So, I don't want to negate the significant emotional effects and role changes associated with this loss of reproductive potential, but I don't want to spend a lot of time. In fact, unless there are questions, I'm really not going to spend a lot of time talking about the fertility aspects of this. I really do want to focus more on sexuality.